Pain associated with knee osteoarthritis is the driver for patients seeking treatment. Knee osteoarthritis is a complex disease, often driven by inflammation and tissue destruction. Interleukin-1, also known as IL-1, and tumor necrosis factor alpha, also known as TNF-alpha, are the key pro-inflammatory proteins called cytokines, which need to be blocked from damaging the tissue. These inflammatory cytokines bind to the cell surface receptors on the cartilage and start the process of cartilage breakdown, which ultimately leads to joint pain and destruction. As exhibited with these two X-rays, knee osteoarthritis is a complex response resulting from the interplay between inflammation, radiologic severity, innervation of the articular cartilage, nerve sensitization, and psychological factors. Therefore, a beneficial therapy requires a mixture of anti-inflammatory and tissue healing factors. There are several naturally occurring inhibitors of the pro-inflammatory cytokines IL-1 and TNF-alpha. These include the interleukin-1 receptor antagonist protein, also known as IL-1RA, SIL-1R, also known as soluble interleukin-1 receptor, and STNF-RS, known as soluble tumor necrosis factor receptors. All of these are highly concentrated within the end-stride autologous protein solution, APS. APS contains anti-inflammatory cytokines IL-1RA and SIL-1R2, which inhibit IL-1 in concentrations well above what is found in native whole blood. Additionally, soluble forms of the cell receptors for TNF-alpha, known as STNF-R1 and STNF-R2, can bind to TNF-alpha. These inhibitors bind to the cell receptors and block the inflammatory cytokines from interacting with the cartilage. Positive outcomes are possible due to the presence of these high concentrations of anti-inflammatory proteins in the final output. IL-1RA helps stimulate a biologic cascade which has been shown to block cartilage destruction in osteoarthritis. APS may decrease the effects of inflammation, which may slow the progression of cartilage degradation and may stimulate cartilage repair. Additionally, APS may reduce joint pain and improve joint function. The treatment is designed to be a single injection therapy at the point of care.